Hello, my name is Peter Steinberg, and I'm a urologist at Beth Israel Deaconess Medical Center in Boston, and I'd like to talk to you today about having a circumcision. A circumcision is a surgical procedure we do in men where the foreskin, which is the skin that covers the head of the penis, as you can see in this photograph, is surgically excised, leaving the head of the penis exposed. This is a procedure that takes about 1 hour. We do this in the operating room at Beth Israel Deaconess Medical Center under a combination of general anesthesia and long-acting local anesthesia injected into the penis to keep the penis numb and free from pain for about 6 to 8 hours after the surgery. A circumcision is often something that adults will choose to do because they're either having difficulty retracting the foreskin, which is known as a phimosis. That can make it painful to retract, difficult during sexual activity or urination, or uncomfortable, and often causing cracking and tearing of the foreskin. Sometimes it's done because people are getting recurrent infections of the foreskin, known as balanitis, that can be difficult to treat with medication. Sometimes people will choose to do this to help reduce the risk of sexually transmitted infection, like herpes and human papillomavirus, or the virus that causes genital warts. And some people choose to do this for either cultural, religious, or cosmetic reasons. The procedure itself, again, takes about an hour under general and local anesthesia. This is done as a day surgery where you have the operation, recover from anesthesia, and then go home. You need someone to drive you home after the procedure. During the surgery itself, as you can see in the photographs attached, the foreskin is removed, and then the shaft skin is sewn back to the skin that remains of the foreskin below the head of the penis with both dissolvable stitches, and I cover this up with super glue that falls off in about a week. We then cover that with a loose wrap and put some gauze and supportive underwear and an ice pack on you and send you to the recovery room. In general, once people have recovered, usually most men are very happy with the results of having a circumcision. However, in the short run during recovery, there's some important things you need to understand about both risks of the procedure and some aspects of recovery. The biggest problem people run into afterwards is bleeding, bruising, and swelling of the penis, and often the penis will be swollen and actually not have a great cosmetic appearance for 4 to 6 weeks afterwards. This is incredibly common because this is a very vascular area, and there can be a lot of bleeding, bruising, and swelling that happens after the surgery. We spend a lot of time during the surgery trying to limit the bleeding people will have afterwards, but often there's still going to be some degree of bruising and swelling. If you have any concerns after the procedure, we're happy to see you in the office or do a video visit to make sure things look fine and you're healing normally, and often this is the case. In terms of infections, these are uncommon after the procedure and can usually be treated with oral antibiotics if that happens to occur. In terms of discomfort, usually most people just need Tylenol and Advil after the procedure to control their discomfort for several days or sometimes a few weeks. It's very rare people need things stronger, such as opiates. One thing related to sensation afterwards is some people find the penis either feels very sensitive in the first few weeks after the surgery or feels numb in the first few weeks after the surgery. Often that will resolve itself within 2 to 4 weeks of the procedure as the nerve endings that have been cut start to grow back. Some other things that are important to understand: we're very careful when we measure the amount of skin to remove so we don't take off too much skin. That will cause your erections to curve. And if we don't take off enough, you'll still look uncircumcised or maybe even need the procedure redone if there are issues with the scar. Most people need to take about a week off of work after the procedure, and with strenuous and physical jobs such as manual labor, I usually recommend 10 to 14 days off of work. Other issues with the procedure are very unusual, such as injuries to the deeper structures of the penis, and occasionally some men do need the scar revised because of abnormal swelling afterwards. The risk of that is maybe about 5% at most. So, in summary, circumcision is done to remove the foreskin, either because it's diseased and it's causing issues, or for cultural, religious, cosmetic, or sexually transmitted infection reasons. We do these procedures as a day surgery at Beth Israel Deaconess in Boston that takes about an hour under general anesthesia. And the main risk afterward relate to bleeding, bruising, and swelling. And it's crucial during the procedure we take off the right amount of skin so you get a good cosmetic result. If you're interested in having a circumcision with us, we'd be happy to talk to you further at 617-667-39. Thank you and have a great day.